Here's a new series where I take a med-surg book and I flip it to a random page and give you an NCLEX test question over a random topic. Okay, so here's our question. A nurse is caring for a patient who is 8 hours postpartum following a cesarean delivery. Which finding requires immediate nursing intervention? Is it A, incisional pain rated as 6 out of 10, B, moderate lochia rubra, C, urine output of 20 mils per hour, or D, hypoactive bowel sounds? Let's talk this through, but put your answer guess in the comments. Before we even look at the answers, let's figure out what's going on here. It states that this patient is 8 hours postpartum and they are post-cesarean or C-section delivery, which means they've had a surgery, plus they have postpartum physiology going on. So we automatically need to be thinking about bleeding, infection, perfusion, urinary output, pain control. So out of all these things, we need to think about what could actually harm this patient if we ignore it. So let's look at A, incisional pain rated 6 out of 10. This is going to be expected. Remember, this is a surgical patient who just had a big abdominal surgery. Pain, of course, matters, but is not immediately life-threatening to the patient. B, moderate lochia rubra. This is also expected. Within the first 24 hours postpartum, lochia rubra, or that red drainage, is normal. We would worry about the bleeding if it was really heavy or soaking through a lot of pads or really large clots. But the key word is moderate at 8 hours postpartum. This is expected. So eliminate that one too. C, urine output of 20 mils per hour. This is a problem. Normal urine output should be at least 30 mils per hour. Low urine output after a C-section can indicate hypovolemia or a hemorrhage or poor renal perfusion, therefore requiring immediate intervention. So this is your correct answer. But let's also look at D, the hypoactive bowel sounds. This is very expected. Remember, this person has had an abdominal surgery, they've had anesthesia, they will have a sluggish GI tract. We expect hypoactive bowel sounds early on. This option is not urgent and you would eliminate this choice. Low urine output seems very subtle, but it's very dangerous. NCLEX will always choose oxygenation, circulation, and perfusion over discomfort every time.